Live Well, the role of unpaid carers in hospital. Shirley and Mick's story. Presented by Shirley and Mick Mitchell of Sutton Vision on the 11th of July 2024.
Welcome everybody. Today we've got Shirley and Mick Mitchell to talk to us about unpaid caring.
Shirley and Mick, we're husband and wife team, and I am the person that needs the care. Firstly, I'm visually impaired, but mostly, which I found much more debilitating, is the fact that I'm very deaf as well, which as a double whammy, it's quite difficult. And also, I am being treated for a bladder cancer at the moment at St George's Tooting, which is an excellent hospital, but they do need some sorting out, which we are in the process of doing actually, which we'll go into later.
Why we're interested in this is because I have been a carer for Michael for quite a number of years, and it affects really, and I don't think people realise their role. We talk about three types of carers. One is the obvious one that everybody thinks a carer is, the person that's paid. This may not link in. Yesterday we went to support a young lady who has visual impairment, but she also has paid carers in. But they come in and they go out, they come in and they go out. They hardly even talk to her.
2 short visits a day.
Because of what it is. But what we are concerned about is the unpaid carers, or those that don't even realise that they are carers, because several of our friends there are looked after. They are visually impaired, they have other medical conditions, but the person looking after them doesn't even realise that they're a carer. And this is where support and help is needed. What we're really looking at is what we would call the number 2, which is the unpaid carer, or the number 3, which is the
family member
not realising they're a carer. I mean, most of you, we haven't got anybody really here today that is a number of VIP people, but it is difficult to assess. You know, we were going to ask you, do you have a carer, and see how many people think that they actually have a carer, because it can be your partner, it can be your wife, your husband, it can be mum and dad, it can be your children, it can be a member of that family, or it can be a friend. And this is one of the biggest areas we've been fighting with visual impairment at the moment in our local area, about people not accepting that they have to bring a friend with them when they go to something. So what do people need a carer for? And that's a really good answer. People say, well, what do I need a carer for? I think people consider being VI and hearing impaired, things like this. They don't really think about people being in the level of what we would call handicapped,
but
or
it's
needing a carer. We often get this image, but he's not in a wheelchair. Well, no, he isn't in a wheelchair, but a lot of people are. The lady we went to see yesterday is VI and in a wheelchair. But they assume that if you come with somebody in a wheelchair, you're going to be needed. And this is where the difficulty comes when we're talking about outside help.
I'll give you just a quick instance with me. When I was first diagnosed, well, just before I was diagnosed with my bladder cancer, I was in St George's as an inpatient, and I was isolated because it was just at the beginning of the pandemic and they wouldn't let Shirley in. So I was totally alone, and to add to this is that they also took away my hearing aids. So I was totally isolated.
You couldn't see?
I couldn't hear and I couldn't see very well, but what I did see was the other inpatients had people with them. So I said to them, why aren't you letting my wife in? Oh, then she's not paid. These people are paid. They're in, which is totally and utterly wrong. And this is what kicked off our campaign for helping the carer?
We've worked really, really hard. We're working with St George's as one of being the major hospital in our area, and also our local hospital regarding this, because we are very, very concerned about all levels of need for carers. And if we don't get it, it's going to cause an awful lot of problems for people. What people don't realise, especially if you're, we have so many friends that are VI, and they don't realise how much possibly their husbands or their partners or whoever it is do for them, and not thinking about them in this carer's role. And we need to get that established and get people protected so that you as VIP people can get the best out of it.
Absolutely.
We say to people, what they say to me, how can you call my husband a carer? What does he do? And I say to them, well, go away, think about how many things he probably does for you. If a carer came in, like yesterday, they came in, they bathed our colleague, they did that, they did this, that, that's, people can see that. But often the carer is the one that gets forgotten and needs sometimes some support. I would say that if you're VI, the list is endless of somebody you might support you. This could be from the minute you get up to the minute you go to bed, or in Michael's case, after he had his operation, he had a very big operation. It was 24 hours a day I was looking after him, because what they required him to do at night, he couldn't see to do. So these sort of things.
Obviously, having a bladder operation, the visits to the toilet is very, very regular. It can be anything up to 3 or 4 times an hour.
Or in Michael's case, he came home with open wounds. He came home with a double catheterization, and we didn't get any support by any outside link. So sometimes your carer becomes your nurse as well, and that can be a very different situation.
Yeah.
There are obviously times when a carer will be of real help, such as a medical appointment. Now, this is something that we've asked for it to be agreed with, that if somebody needs to go, we have a lady at the moment, quite a senior lady in one of our groups, and she was a bit worried about taking a friend with her when she went to get some details of a medical condition. And the first thing that happened when she went in, the doctor said to her, "And who's this with you?" Not in a very, she said it wasn't very nice. Obviously, because she's VI, she needed somebody to take her in anyway, but she obviously intended her friend to be with her. And that can be very, very awkward. We had one yesterday where a gentleman told us that they turned to him and said to her, "Oh, is it all right if I talk to your wife?" And it makes it very pointed that somebody's possibly with you. And that's not necessary. You might need somebody with you, might need somebody right the way across the board, but it must be obvious that there is going to be times when a carer must be present. As an example for Michael, when he was in hospital, they realised after the first time they'd had him, well, he was so much nuisance, weren't you?
Oh, I
Yes,
was. I made
definitely
myself
a
a real pest.
Yes, yeah. They realised that he needed somebody with him.
With vision and mobility.
It's really difficult because sometimes with a hearing difficulty and a VI problem, you need another pair of ears listening. The first time it happened, he thought they meant it was okay and that was all right, and it wasn't. It was, they come in to tell you it wasn't right, and so on. And there were so many issues that we've realised that it is so important that VI person, if they want to, have a carer with them, and that can be set up right the way through for whatever it might be. But this is what we're asking people to be aware of. Make sure that if you are having somebody, now the first time I took Michael in, I never even thought about thinking, should I have said anything? Should anybody have been aware of your condition? And that's probably where the mistake came, wasn't it?
Yeah.
But it is important because you might need a carer in everyday life to access. We say it might be just a matter of being there to hold a hand, to be there to listen to whatever it will
hold
be.
somebody's hand.
But to make sure that you've got everything you need to them. We have found now that if you are a carer supporting a VI person, it is a very, very good idea that you inform the people before. If it's a planned operation or a planned treatment, you tell them that he has or she has a carer, because this can make a difference. Mike had an operation 3 weeks ago, and immediately I got there, we had spoken to the people about me being there. And when we went for your pre-op, it was wonderful. They said, they know me very well in this. It's Michael's 13th operation. So in the last sort of 2.5
you're back
years.
again, they say.
But it's made us realise what we can try and do and stand up for people. Because when we got there, that was fine. They thought about some of the things. Sure, all of you will appreciate the fact that giving you a little tiny wee pot when you go for any samples is absolutely ridiculous.
It's totally impossible.
You know, especially if you, ladies and gentlemen, it doesn't matter. This tiny little wee pot, what are you going to do with it? You know, it's bad enough when you've got vision, let alone if you haven't got any vision. So it's something that we're trying to put in place, and it is working. Now, when we go now for into your area for pre-op, they've worked out that they give Michael a little metal.
But not only have me, but everybody gets it.
It's not isolated.
Just not us, just not me. It's everybody gets.
You get your little
pot to wee in, then it can be transferred into the testing.
Yeah.
You know, I mean, we had such a laugh the first time we went. She sent you off, didn't she, on your own with this little peep, and you went, what do I do with this? And
I am a white stick user.
Yeah.
So it's obvious that I am visually impaired.
This is but it's those little things that when a carer's there, they can support somebody. It doesn't matter who you don't have to, but as long as they know you're going to bring somebody with you. Now, what has happened since we started pushing this, 3 years ago?
It's 2020.
Yes.
4 years.
We have found out that in a lot of the hospitals now and the centres, they have put together something, some of you can see this. It's what we call a carers and hospital discharge tool pack. And what the idea is that this is now on all wards and staff in most hospitals. We're not saying that every hospital puts it in place, because we know it's like anything. They would like it to be used, but it gives a good insight into the process of where the carer can be and where it can help. We know probably one of the biggest things is when somebody comes out of hospital, because they can't wait to get you out of hospital. It's, when you're going home. Oh, yes, right. But what we're now asking for to make sure that if that person has a problem, is there going to be somebody in place with them? Is there somebody that can be there for the discharge? Recently with Michael, after his last op, she actually came and asked him, would you like your wife in for the discharge? And you said yes, didn't you?
Yeah.
And then I know exactly what the procedure is, what I'm expected to do, what medication he might need to have, etc. And actually see the copy, the written copy that will be going to his doctor or whatever, which you can't see.
Yes.
So these things can help right across the board. Again, some hospitals now where you go into, they'll have a carers pack. it's given on the first day will ensure that all the relevant points needed to inform the carer and the patient, it's there. So how does it work? What time can you be in? Do you want to be in all the time? When Mike had a major operation last year, I could have stayed in overnight. They put us in a side ward and they would have let me stay overnight with him. So these sort of things can be put in place to help the staff as well as you. But it does depend, doesn't it? Some hospitals now will have a badge that says, I am a carer. But
So that therefore you're allowed access to your
whatever it might be.
whatever.
Yeah. Some places, I was lucky on some of the wards that you've been in, they've actually fed me. I've had breakfast, lunch and tea, but that just depends. But because they get to know you and they know how valuable you can be. I mean, in Michael's case, if he's on a general ward, he's got to then try and find the bathroom or he's got to find somewhere to wash.
And they insist on people exercising, out of bed and exercise. Now, if I'm walking up ward corridors, if anybody's been in hospital lately, you'll find that there is equipment and rubbish everywhere. So I couldn't possibly navigate around that lot without help.
Yeah. The other thing that we have been able to put in place, which is a very useful item, is this that we put in place, which is a list of all different organisations that are in the particular area of where, and we've asked for this to be done right across all the health authorities, so people know where to go if they need to.
Now, when we go into St George's, these are everywhere.
Yeah. We worked with St George's on doing this one for our area, which is, it's Merton, Morden, Wandsworth, Sutton, Cheam, and Epsom. And we worked on there and it's got all of the different organisations that can help people. Because people sometimes don't know. I mean, when Mike had his chemo, I didn't know that I could have gone and got some stuff for myself because Michael wasn't, instead of going in and having his treatment and coming out at the end of the day,
it was during the pandemic.
I had to take him in
and immediately go home.
And he wasn't allowed to pass water.
Exactly 2 hours.
So once he'd done that, but then unfortunately what he was actually weeing out was highly toxic. So I couldn't use the bathroom.
Shirley was not allowed to use the bathroom.
So, if you'd have had any carers in or whatever, we would have needed another support there. And these sort of things, we're learning how important it is to think, we're trying to support people in advance than we did before. But there's also in place new regulations this year, guiding, which has come in since the pandemic, because during the pandemic, so many people did become the carer at home because carers weren't coming to your home. It was often expected of the person to be looking after the person that they might be at home with. And what happened was when people started to go back to work, they realised, oh gosh, we're leaving lots and lots of people on their own when they need help. And a law has now been passed and it is called the Carers Leave Regulations. Now, most good companies or firms will allow time off anyway. I mean, we've got a young grandson he has a lot of medical difficulties, and both his mummy and daddy, they're very, very good when he goes to hospital and so on. But there's a lot of people out there that are still working. And this new act that has been passed is allowing the patient and the carer to understand that if they need to have time off, and it might be a block of time, that they can use this to be with that patient. And I think that's a very relevant thing that's come out of the COVID for the carer. And that will mean that they can follow it through. The other thing we ask people that are carers, do they bother to register themselves? Now, it's worth registering yourself as a carer. You can go through your council. You can go through it. Maybe in our case, we're lucky we have a carers
association
locally. And in most areas in our area, which is the London area, do have a carers association, and they can be terrifically supportive of you.
in many ways.
Yeah, they can tell you about the sort of things that you can claim for. So if you happen to have to give up work to look after somebody, they can support you there, guide you through and tell you where to go, where to get help. They will also tell the person, like Michael, that he can get allowances which will give him extra facilities so that we can, I can take him by taxi rather than having to try and scramble him on a bus. There's so many things out there that they know.
There was a time when I was not allowed to go on public transport. I had to go by private car or by a taxi. And Uber have been absolutely wonderful to us. Fantastic.
Yeah, I mean, it just depends, but we find that if we can get people registered, you don't have to attend any of their things unless you want to. They're there to support you as a carer. So if you think, well, I'd like a day out or something, they've got days out. You go with other people who understand the problem that you're having to deal with. We belong to something called Immaculate Group. And we have quite a few carers, ladies, that come to our Immaculate Group because not so much because they've got macula themselves, but they're the carers of their husbands and partners who have difficulty. So they come and have a little bit of respite and somebody pops in and looks after the person concerned. So it's quite good. Another real good advantage is to make sure that on your GP records, you register as a carer, and on your person that you are supporting, know that they have a carer.
So they do attend the consultations with you.
And also, if a person is VI, they need to make sure that all their records show that they're VI. At last, we've got through, after many, many years with Michael and our GP, that you are VI and got a carer. But what was nice when Michael had to go 3 weeks ago for a blood check, they actually, and a wee pot, they actually had a wee pot ready for him, instead of just the bottle. Didn't make a big thing of it. So we got that far.
They had a funnel attached to it.
Yeah, but it's those sort of things that can make a difference. And I didn't realise that we need to be registered on our medical records because that then comes up and shows. So I think for the carer or the person that might need a carer, that's important. Carers can claim, even if they're working. You can work for so many hours and then claim carers allowance. But again, that is something that an organisation would be able to help people with. On the nicer side, there's other things that you can do being a carer with your VI person. A lot of places now you can go buy one, get one free, you can go on lots and lots of trips and things. A good way of having some sort of recognition is what we were advised to do, is to get a Nimbus card.
Like that.
And this Nimbus card...
that flowered emblem is the recognition for the Nimbus access card. And that indicates that the person who's wearing it, which is me, needs a carer. In my case, I need access to a toilet and seating.
And that you're visually and hearing.
And I'm visually and hearing impaired.
So it's got little symbols on it so that people can just quickly look at it. But we're finding the people that we meet, a lot of them are now, and they're really excited because they're off to, we've got a group going off to Kew Gardens, and yes, that's fine. And, they're going to a show in London. So it was buy one, get one free. And that can make such a difference.
Do this, that's all online.
Yes. Also, it's quite useful when you go to the hospital. The hospitals recognise the yellow symbol as being somebody that needs support in some way.
Yeah.
And, you know, we are getting there, aren't we?
Yeah.
You know, it means that they look after you. You may find that there's lots of places that you want to visit with a carer. Take 5 minutes out and find out if you've got a carer with you, is there a special arrangement? Is there somewhere like one of the ones we looked at was Westminster Abbey? They have a separate entrance for VI and carers. And wheelchaired people, and that is free, and they provide a guide. So there's lots of things out there that people don't think about until you start looking into perhaps a little bit more. You know, we used to work at Swisley at one time. We were we used to work
voluntary at Wisley.
And you know, the number of people that we used to bring through, and people didn't realise that they could come through with no charge. So there's so much out there. I mean, our local cinema do a special day for VI and carers and anybody else that would like to come. So there's a lot out there that people don't really realise, that having a carer can help you get to these places and enjoy it. Probably one of the biggest areas we really think about is having somebody to share something with, or when you're in an area, this is what I try to explain to them at St George's, it's fine somebody coming into a massive hospital, but yes, Michael's all right at home, he knows all his bits and pieces around, he might bump into something or spill something or that's fine. But once you're in an environment you don't know.
And George's is huge.
Yeah, you do need somebody at your side. I was, quite frankly, the last 12 operations Michael's had, I have been in with him from 8 in the morning till 8 o'clock at night. And to be fair, it has been such an advantage for him.
And for them.
Yeah, because they haven't got time to take him for a walk. They haven't got time to take him to have a wash.
For instance, there was one occasion where an emergency happened in the little bit of ward where I was, and Shirley and all the staff had to attend this emergency, and Shirley was able to make sure that the other inpatients were okay if they wanted tea or coffee. And as one very nice old chap, but he was suffering with a little bit of dementia, so he always wanted to escape. He got it into his head it was going home, so she had to be brought back again.
And this is another area, obviously, it's another area that we talk to the Dementia Society about, making sure that when they come into hospital, that the person, and often it is often the wife or the husband that will bring them in, don't realise that they have the right to be there. And the carer does have the right to be with that person.
Stand up for your rights.
We're talking to more and more people now. People are living longer, so we're going to have a lot more problems. From the pandemic, we had a lot more people with VI problems. So it's increasing to what we're going to need. And I say your carers are the most valuable people. They probably don't realise how valuable they are, but they are jolly valuable. I do feel I need a label sometimes that says, who are you? Or, you know, because sometimes I do feel this idea of perhaps having an acknowledgement badge is a useful thing, but it is important. If that person doesn't want you to be there, they're going to tell you anyway. They're going to say, no, I'll be all right. I'll be all right. Okay.
Am I just allowed to interrupt?
Yes, please do.
Do you mind? Oh, thank you. Marlene has dyslexia, so I went to the admin at the hospital before his operation to say, I need to be there to fill in the forms, before he goes, blah, blah, blah. But I made sure that I went to the right person. I think that is a difference. Just anybody behind a desk or a passing nurse doesn't really filter through.
No.
So going to the right person, I was able to go to the drive-through COVID testing with them.
Yes.
And they asked me, did I know my national insurance number, which I did. So I wound the window down and told them. Drove home the 2 hours drive ready for the results to come through, so that I would be admitted free of virus,
Yeah.
Unfortunately, because I wasn't in their digital system and they took it manually, I had to go back again the next day. But not a problem, as long as I could be there at 8 in the morning, and I was able to go there and back before Len even woke up out of bed, which was great. And then when I arrived, the 24 hours then wasn't quite ready, but because they knew, they just made me welcome to wait until the results sort of came through, and then I was able to go through with him. And then after that, they kept asking me, would I like to be shown my room? And I wasn't quite sure what they meant by that, but they actually had a room there for me. I didn't want to go into it until about 11 at night to make sure that it was all right, blah, blah, blah. So I'm in a room with a view, a telly, a flip-top bin, sensor bin that, when you went past it opened, and it was, totally remarkable. And I said I wasn't, ready for this. I bought a flask and some long life biscuits and peanut butter sandwiches that didn't have to have a fridge, to sit in the car with a pillow and wait in the car park sort of thing. And they said, oh no, our role is to look after you, not just your husband, to look after both of you.
Yeah.
It was impeccable. So off I go to bed. Early in the morning, I'm just about to clean my teeth, and somebody comes not into the room but into the ensuite and says, oh, he's asking for you, would you come through? And I said, of course I can. I said, is he all right? And he said, oh yeah, just that through the night he was asking for you. And I said, I did ask you to call me if he wanted me. And she said, no. She said the supervisor or matron, whatever she was, said that you need your sleep and we weren't to disturb you.
Wow. Isn't that a lovely thing to
It was.
And
the follow care, it just continued. It was remarkable. And that was Wrightington Hospital near Wigan.
Yeah.
Absolutely superb. They were ready for us,
I think we are going to find this more and more. I mean, obviously, because we deal in London, so they're getting patients coming in from all over the place. But I think they're really, really thinking how valuable you are.
Can we ask where you are?
Wigan. Yeah. So
2 hours from Wigan, yeah.
Yes, yeah. But that's it.
I didn't hear that.
Yeah. I think that's an extremely good example of what we're trying to achieve right to the end, because you'd only worry about him. You're going to, when Michael was in the first time when he went in.
When I went in as an emergency.
Yeah, I couldn't talk to anybody on the phone. And
about 1:30 in the morning, I was still being treated in A&E. And the doctor looking after me said, can I ring your wife? Do you think she'd be awake? I said, she'll be awake, all right.
Yeah,
No problem.
But I think that's a very good feedback, because we want to hear good stories like that, because that means that what is happening...
Somebody's doing a good job.
Yeah, because it is important. It is important that the carer is there and can help. And in your case, it's slightly different need, whatever it might be. But the role of the carer is special. Do you think yourself as a carer?
Oh, definitely. But I think the key is going to the right people all the time. And for example, at Preston Hospital, if you look at the car parking notice on the disability sort of section, it advises you to go to a certain window within the hospital. They log your details, and then that, and also a sister hospital at Preston, when you drive in next time, it remembers your number plate, and you can park for free in any of those hospitals.
That's excellent, isn't it?
Without any more paperwork, you know?
I know we've got it. You can park anywhere at the hospital as long as you go in and tell the office, as long as they know that
register your car.
Yeah. Well, we don't drive, but our daughter normally takes us.
Yeah.
But it's those sort of things that can make such a difference to people and looking after people. And I'm glad to see that you recognise, because I find we talk to so many people. I mean, I was talking to a lady on Monday afternoon in a group, and I said, so you were your husband's carer? And she said, no, I'm just his. And I thought, he's
You are.
You are. And she said, I haven't really thought about it like that. And I said, yes, you are.
Yeah.
You fight on his behalf sometimes, like you're saying. make sure you talk to the right person. And that is so important. And we're learning now how important that is, because if it doesn't get to that person, it doesn't get then put on the form. Because when we walked into the reception after I'd spoken to them on the previous Wednesday about you coming in, the man at the reception said, "Who are you and where are you going?" And I thought, yes.
He's no longer there, by the way.
No, because we're working in the linking there, they're talking to us about being not so much a spy, but we have to feed back on everything now that we do in line with the board. What was interesting, I'm so pleased to hear you say that about them now, because quite recently we have done sessions with year 2 doctors. So the whole thing is looking at the patient holistically.
And who they're with.
And this is a new part of their course that they're going through, that we actually we were talking to them about what are the people that come to you, what is, may they have a carer? What is their environment like? Could it be somebody from the street? Have they got any conditions that you should be aware of? And Michael was a patient recently for the doctor's final exams.
And that was a very interesting day.
That was good because they realised that something wasn't quite right, wasn't it?
Yeah.
And they picked up, and I thought that was a good day. We did 7 till 7 that day.
That was a long day.
But it's the first time in any exams that they've allowed a carer to be present. And they wanted to see how it worked. And they thought it worked extremely well.
Really well.
So we are moving on. But it's lovely to have a good report. That's
yeah. That's brilliant.
Yeah, lovely.
Yeah.
Thank you so much.
Yeah.
That was really...
Anybody
really
else want to ask?
Thank you. Yes. Anybody got any questions for Shirley and Michael?
No.
Very inspiring.
You might find, a lot of people might find that they'll find little leaflets now in all the hospitals. They're up and it says, "Are you a carer?" And, you can pick them up and it gives you an idea of what your role might be. I took Michael this week for a blood test and it says information for the carer, which I thought was great. It meant that there was an elderly lady who had a lady bringing her in, and we both were able to go into the cubicles with the person. Because Michael's deaf as well, because he goes, what? Because, they speak very quickly and often...
And if you're behind a mask as well.
Yes, we're going back to masks in the hospital again at the moment.
We are.
So these sort of things can really help. So, it's
interesting that you say, Shirley, actually, about identifying yourself as a carer. We have a local support organisation here called Carer Support.
Yeah.
And they find that people, they try and encourage people to come as early on in the caring journey as they can. Yeah. But because at the early stages, people don't, I think you've identified, don't identify themselves as a carer. Often people don't reach out until they're at sort of a crisis point.
Yeah.
And, don't realise that they could have had quite a lot of support and help before that.
Well, I did that. After the first operation Michael had, I didn't know where to go for help. And one of the nurses said to me, "Why not try your council?" So I rang the council and she said, "I'll put you straight on to Sutton Carers." Well, they couldn't. She was on for about an hour explaining to me.
Really.
And I thought, this is what we've got to do. And we have worked tirelessly for
4 years now.
4 years now, really pushing this. We did a talk on Monday about this. It is important that people, it's not anything wrong to be a carer. It's not anything wrong to be...
But it is right to push.
But it really made me realise yesterday, seeing those paid carers coming into our friend. It was very clinical and there was nothing personal. They were very nice, but they were going at about 100 miles an hour.
There's no little chit-chats,
No. Yeah. I mean, I've been involved with this young lady for, nearly 40 years now, since she was very tiny. She has a visual impairment and she's in a wheelchair.
She had mobility.
Yeah. She didn't have one thing
Now
after another.
now she has no mobile.
What was
mobility.
introduced, she then needed our support as a friend carer to help her with a problem that she's trying to move to be near her parents. And some phone call came in and she absolutely panicked. And it was good that we were there to sort it out. And I had a text back from her later and she said, it's all okay. It's okay. So
Shirley, I think Veronica might have a question.
yes,
I
please.
have two, actually, if I may.
Yes, go
I'm
ahead,
Veronica, and I work for a local NHS trust. I'm visually impaired. I've been blind since birth on one eye, and I recently had vitrectomy, which didn't go that well. So I'm still off work, hoping I will recover to some extent with reasonable adjustments to go back to work. We also have a carers network that's open to both paid and unpaid carers. And I was just wondering, when you were talking about registering yourself for the GP, I bet if I bring it up, the question will be, what actually are the benefits? Why should I tell the GP?
Why should you register yourself?
Yes.
One, because they will give you, the first thing they give you is a letter.
Letter saying this person is a bona fide
Yeah, and who you're
carer
there.
of a
And
husband.
whatever you feel that you need to be allowed access to, they will put on that letter. And then as the time goes on, you can have that letter renewed if you are still the carer. The other benefits are that they will tell you exactly what you could be entitled to. Also, they will help you get the forms. They will help you fill them up. You can either go face to face with that person or they will do it with you over the phone so that you've got good details. They know what to say and what not to
What
say
to say.
Mhm.
and how to put it. I think that's the difference, yes.
Thank you very much. Question number two.
It's a pleasure.
Yeah.
Great stuff.
When I had the surgery, I'm based in Hertfordshire. My husband came with me because there was a chance I would initially be blind. There was a risk of retina detachment, which unfortunately happened. So when we arrived, we had the expectation that we would get a chat, more for him to understand what's going to happen once she's out of theatre. What's
Yeah.
my role? How can I support her?
Yeah.
And shockingly, we got there, dragging off a nurse. Who are you? Are you your husband? Can I have your mobile number? Are you going to pick her up? And that was it.
Yes, I agree with you.
So
And this
I
is
was
what
like,
we're
so this
fighting.
right to be
Yeah.
there
Yeah.
wasn't
Yeah.
given.
Yeah.
It was shocking. And the same when I came out, I couldn't say I wasn't offered a wheelchair. There was no signposting. So he had to learn to navigate me around the hospital. And it was just shocking.
Yeah. So really what you need to do is get your carers group to talk to the management and say, look, this is not what we're expecting. We need now to be there because that person, you're going home much more in advance to what you might have done. It could be the next day or 2 days after. The person who's then going to be responsible. So there is now a setup, which is a computer setup that has to be filled in by each of the wards, and it should say who's going to take, and they should then have spoken to your husband like they did to me. But this has taken me 4 years banging. Michael's had 13 operations in, just under 3 years.
But now she actually comes right into the anaesthetic room.
Yes.
with me.
Yeah, I'm really,
My
quite-
worry is in the next 12 months I could get cataract and I might end up with retina detachment and blind again for the first 3 months. I don't want my husband to be sent away.
No,
Can I actually
don't let
say-
him be sent away.
No.
No, he can be right the way through it. And as your colleague said, I went through the same procedure during the pandemic. I used to have to go with Michael to have all the tests done. Then I had to, but you need to get that structured in place. And really, I sometimes think you have to be a little bit forceful.
Oh, yeah.
Thank you, everybody. That's been
Yeah.
great. Thank you so much. We're very inspiring.
About Live Well. Live Well is a series of events aimed at helping people make the most of life with sight loss. Live Well is a collaborative project between 6 local independent sight societies. Sight Advice South Lakes, Cumbria, My Sight's Notts, Nottingham, Sight Airedale, the Airedale area of North and West Yorkshire, Support for Sight, Mid and West Essex, Sutton Vision, the London Borough of Sutton, and Outlookers in Huddersfield, West Yorkshire. We hope you enjoyed this presentation. Live Well events take place on the second Thursday of each month at 10 a.m. Future Vision sessions take place on the fourth Thursday of each month at 10 a.m. and are technology events aimed at people living with sight loss. To attend the next session or to suggest future topics, please contact your local Sight Society, who will be able to provide you with the Zoom link.